I want to raise the issue of the patient safety bill. Members will acknowledge and remember, I'm sure, that An Taoiseach reiterated a promise of government to achieve full open disclosure at the time of the death of Vicky Phelan. Recently, that was reiterated by the Taoiseach. Now, the legislation is to come before the House. The debate is to be guillotined. The Minister for Health has tabled 50 separate amendments. But the one amendment that we needed to see to prescribe in law the absolute obligation for full open disclosure is not there. The legislation means that where a discordant or an erroneous or incorrect cancer screening will become a notifiable incident, but the duty of candour is not there. In fact, it would still fall to the woman to require a review. This is outrageous, absolutely outrageous, and totally unacceptable. And the fact that the government would seek to move flawed legislation in this way and to furthermore guillotine the debate is all the more insulting to the women who have suffered as a result of the cervical check scandal.
We've waited over 6 months for government amendments. They were circulated, we received them on Friday morning. There are 42 pages of amendments from the Minister. There has been no briefing, there has been no pre-legislative scrutiny, and the deadline then was on Monday morning for amendments to those amendments. It's an entirely unreasonable way of dealing with business that is very important. And really, the Minister and the government needs to rethink this. It's not possible to deal with that level of very serious amendments without any kind of briefing from the Minister or his department.
Mr. McGrath.
Thank you very much, Ceann Comhairle. First of all, in relation to the patient safety bill, I think the key issue that has been raised here in relation to open disclosure, it's just important to clarify what the position is in that regard and not to confuse clinical audits with patient requested reviews. They are different. They are explained clearly in the report that was published by the expert review group, and a new patient requested review process has been developed for screening following the guidelines from the expert group and designed in conjunction with patients, including the 221 plus group. And just to put on the record, it will be mandatory to disclose the results of these reviews to women. Very few countries currently have mandatory disclosure. Yeah. So look, we'll have the debate with the Minister, but that is the kernel of the issue that has been raised with me and that I've heard raised publicly. But the Oireachtas will perform its function in respect of the legislative process, and that will take place, as I understand it, tomorrow evening.